Welcome to Krones WellNest, where wellness meets wisdom and your health takes center stage. If you're on a quest for a healthier, happier you, you're in the right place. But before we dive into the treasure trove of well-being, hit that subscribe button, give us a thumbs up, share the wellness love, and drop a comment below. We thrive on your support. Thanks, loyal viewers, for joining us on this journey. Let's soar to new heights of health together. What if I told you that understanding just a few key facts about your health could literally save your life? That's right, today, we're talking about cervical cancer, a topic that's too important to ignore. Whether you've heard a little or a lot about it, stick around because we're diving deep into the signs, symptoms, diagnosis, and treatment. Plus, you'll learn the one thing you can do to prevent it. This is information every woman needs to know, so let's get started. Let's start with the basics. What exactly is cervical cancer? Cervical cancer begins in the cells of the cervix, which is the lower part of the uterus that connects to the vagina. It's one of the most common cancers in women worldwide, but here's the good news. It's also one of the most preventable and treatable cancers when caught early. So why should you care? Because knowing the signs and symptoms can make all the difference. Cervical cancer usually develops slowly over time, and it's almost always caused by a persistent infection with certain types of human papillomavirus, or HPV. But don't worry, we'll talk more about prevention a bit later. Now, let's talk about something that's crucial: recognizing the signs and symptoms of cervical cancer. In the early stages, cervical cancer might not cause any symptoms at all, which is why regular screenings are so important. But as the cancer progresses, you might start to notice some signs. These can include unusual vaginal bleeding, like bleeding between periods, after sex, or after menopause. You might also experience a watery, bloody discharge that can be heavy and have a foul odor. Pain during sex or pelvic pain can also be warning signs. But remember, these symptoms can be caused by other conditions too. So if you notice anything unusual, it's time to see your doctor. If you're experiencing any of these symptoms, don't wait. The sooner cervical cancer is diagnosed, the better the chances of successful treatment. So, what happens if you need to get checked out for cervical cancer? Don't worry, I'm going to walk you through the process. The first step is usually a pap smear, also known as a pap test. This test checks for abnormal cells in the cervix that could become cancerous. It's quick, it's simple, and it can save your life. Sometimes, the pap test might show changes in the cervical cells that require further testing. That's where the HPV test comes in. This test looks for the virus that can cause those cell changes. If either of these tests suggests that there might be a problem, your doctor might recommend a colposcopy, a closer examination of the cervix, or even a biopsy to get a clearer picture. It might sound scary, but remember, these tests are designed to catch problems early, before they turn into something more serious. And early detection is key to successful treatment. Now, let's talk about treatment. If you're diagnosed with cervical cancer, it's natural to feel overwhelmed, but there are many effective treatments available. The best treatment for you will depend on how advanced the cancer is and your overall health. For early-stage cervical cancer, surgery is often the first step. This might involve removing just the cancerous cells, or in more advanced cases, removing the cervix or even the entire uterus. Radiation therapy and chemotherapy are also common treatments, especially if the cancer has spread beyond the cervix. These treatments work by targeting and killing cancer cells, but they can also affect healthy cells, so it's important to work closely with your healthcare team to manage any side effects. And here's something really important: there's no one-size-fits-all approach to treating cervical cancer. Your treatment plan will be personalized to fit your needs and give you the best chance for recovery. But here's the thing: what if you could prevent cervical cancer in the first place? That's where the HPV vaccine comes in. This vaccine protects against the types of HPV that most often cause cervical cancer. It's recommended for girls and boys starting as young as 9, but it's never too late to get vaccinated. And don't forget those regular screenings. Even if you're vaccinated, Pap smears and HPV tests are still essential. They catch any changes early, before they turn into cancer. By staying on top of your health, you're taking control and reducing your risk of cervical cancer dramatically. Let's take a moment to hear from women who've faced cervical cancer and come out stronger on the other side. Their stories are a powerful reminder of why awareness and action are so important.
I was scared when I got my diagnosis, but my doctor caught it early, and that made all the difference. I'm so thankful I kept up with my screenings.
The HPV vaccine gave me peace of mind. Knowing I'm protected is a huge relief.
So, what can you do right now to protect yourself? First, if you haven't already, talk to your doctor about getting the HPV vaccine. It's safe, it's effective, and it's a powerful tool in preventing cervical cancer. Second, make sure you're up to date on your Pap smears and HPV tests. Regular screening is the best way to catch any issues early. And finally, share this information with the women in your life, your friends, your sisters, your daughters. Let's spread the word and empower each other to stay healthy. Cervical cancer is preventable, and by taking these steps, you're not just protecting your own health, you're helping to build a healthier future for all women. Thank you for watching, and don't forget to subscribe for more important health tips that matter to you. Let's take control of our health together. If you found these videos helpful, make sure to adopt the healthy habits into your lifestyle. Share this video with friends and family to spread the knowledge, and hit that subscribe button for more health insights. Your support means the world to us. Stay healthy, stay hydrated, and until next time, take care. Thanks for watching. Subscribe, and see you in the next video.